I'll show you two quick ways just to assess the breathing pattern. I think what's one really important point here is to note that we don't want the client to know that we're assessing their breathing pattern, because that itself will change their breathing pattern. They'll start thinking about what they're doing there as far as the breathing is concerned. So when they're first seeing them, you may just want to take note of how they're breathing, how they're resting, how they're kind of generally holding themselves. Before you even try to do any kind of clinical assessment on them, just see how they breathe in general day to day. Then, maybe somewhere along the assessment process you can tell them just to, okay, I need you to relax, take a big breath in. Not telling them that you're actually looking at their breathing pattern. Yes, hello. So you can tell them, don't tell them you're looking at the breathing pattern, just kind of trick them into doing a big breath in. So see what naturally they breathe in, hands out of the pockets. Okay, just breathe, take a big breath in, just relax. He knows what we're doing, but breathe in, big breath. Just want to relax. Okay, most people are going to go, okay, so we're going to see whether they're a chest breather, whether they can get expansion from the chest, whether they're trap dominant, whether these, what we call the secondary respiratory muscles actually become dominant. So we want to kind of see whether SCM actually fires up when he does this. Trapezius is going to be tight and fired up because of this too. He may have restriction in intercostals. That's why I had those pictures of the intercostals there, so you know what I'm talking about at this stage here. If the intercostals have restriction, you've got no movement from the rib cage. One thing we can do for that is just measure tape around here, get him to breathe, and just see how much expansion on the measuring tape. With someone like him, he should have about 1.5 inch separation and expansion on the rib cage as he breathes in.
Is there a specific ratio or looking?
Not ratio, you're looking at about 1.5 inch expansion to 2.5, someone like your size. A female could be kind of like 1.5. I'd like to see a female like 1.5, but some females might be 1. We did assessment on everybody in the seminar in Singapore, and one girl was 0, like no movement at all. We usually see a little bit of movement, even if it's a 1/4 inch. But remember the girl I had to do work on? We just measure through here, just around the expansion. Yeah.
Right at the sternum.
Yeah. We just measure. Well, actually, give me 1 second. I'll grab a tape measure. Show you. Should be about 1.5 for a female. 1 to 1.5 for a female. You can, more than that's not a bad thing. For male, we want to see minimum of 1.5 to 2, in that kind of reference range. In inches, that is. So what I'll do, actually, I always measure this from behind. So turn around that way. Yeah, and put your hands down. Just relax. So I've got the measuring tape here. I just get him to expand his chest. Just breathe in, big breath in. One more. I usually get 3 breaths. He's got 1.25, so he's a little bit short. But I'm sure if I dug into the intercostals,
Yes.
Yeah, okay. I won't do it. If I dug into the intercostals, you would see some restriction here. 1.25 is a little bit short, so straight away we know that part of the restriction of the breathing pattern for him is his ability to expand the rib cage. So for you guys, you might want to reference out to, refer outside to a good massage therapist or physical therapist or myself, someone who can go in there and open up those ribs there so they can actually get the expansion there. I can usually, one session usually expands, it's back to normal. And in one go, I'm talking about probably about 10-15 minutes work on there, you can get that expansion back. I won't waste time now for this because this is not what we're doing here.
You're just getting 1 to 2 trigger points in each costal?
It depends.
Or you just get
I'm finding through, I may be going through deeper into the trigger points, I may be doing it on the fascials. I've got to get in there and feel what's going on. Let's get into soft tissue work and kind of the neuromuscular therapy and stuff. And you guys do that? Yeah. But it gets pretty nasty. It can be pretty painful for some people too. But the girl, I improved her by, she went up to about 1 inch after, a couple of treatments. From 0 to 1 inch.
And then you just have them breathe to stretch it?
We do, well, we're going to go to the exercises we use for that pattern after that. Okay. Now, other assessment we want to do, now we start kind of looking at more precise assessment. So I'll get the client to lie on the table, Luke. So he's lying on the table here, knees bent, just relaxed. And this is where we just want to see what he does too with his breathing pattern, whether he's chest dominant whether he's actually breathing with diaphragmatic breathing or not. He's going to be a little bit more conscious about it now. I still don't kind of tell him too much what's going on. Also note whether they're mouth breather or nose breather. They breathe through the mouth, there's a couple of issues with that too, okay? So, just breathing in, take a big breath in. There's a lot of restriction actually, you do. Okay, so if I was to dig in here and I can kind of make him squirm for a little while. Oh yeah, oh yeah, oh yeah. Okay, so he does have a lot of restriction in the rib cage, so that's going to be a limiting factor. I would suggest you tie up, depending on which area you live in, tie up with a massage therapist unless you can do it yourself and kind of get into releasing these ribs here. He's probably a little bit ticklish too.
No.
No? Just know what's pain coming, huh? Okay, hands down. Okay, so let's see what we're often going to see is the person's not actually going to breathe up. They're going to breathe up this way. They're not going to breathe out this way. So take a breath in. So he doesn't really move the chest much. He's going to breathe up through those secondary respiratory muscles, which are the trapezius and the cervical spine, the cervical musculature as well, including the SCM, of course, is primarily in there, and that causes a lot of trigger points in through there as well. And you'll see a lot of trigger points into the through the subclavicle as well. So he may not so bad because he's not so much up here. He's just got a lot of restriction in his breathing here. If you're working with an athlete, this is going to make a huge difference because the oxygen uptake is going to increase, which is important for you guys. Yep.
So there's a difference between somebody that's not able to expand the rib cage or somebody that just breathes through their traps and their skin is like, up here.
Well, if he can't expand through here, okay, so the difference, you're asking what the difference between normal breathing pattern?
Well, yeah, so you're saying that some people can just be restricted through their rib cage and other people can be overly dominant.
Okay, yeah. So some people can be restricted to the rib cage, but when we do see that, we are going to see hyperactivity through here because the only way they can breathe is breathe up, because they can't breathe out. We may see people who still have regular, chest expansion, but then they still breathe with the secondary respiratory muscles. Okay, they have a reverse breathing pattern. Often these people are also mouth breathers as well, which is a huge concern tying in with that and other reasons as well, which we won't get into because it's more clinical reasons. What we also see with those cases too, a lot of trigger points in through the diaphragm here, which Luke is a little bit scared for me to even think about touching those. If you're sitting down here too, also take a note, he's got one rib side, one rib, a little bit more expanded than one side than the other. It's lifted a little bit more on one side compared to the other, so we can take a note of that, so we know that there's a lot more stuff going on this side. For me personally, I'll check the thoracic as well, looking at the rib and the rib positioning in the thoracic spine as well.
All the way around with the intercostals.
Yeah, I'll get you both ways. So, but what we want to look at here at the moment is just how the breathing pattern's happening. What's going on with the breathing pattern? So, is he breathing with his secondary respiratory muscles? Is it expanding through the chest? Is this stuff working through here? You get people who do reverse breathing pattern. They breathe in, this goes in. Okay, breathe in and try to draw that in. See that lift up through here? They do that reverse breathing pattern. You see it more in females than males. The reason for that is that usually a stress response. And females go through a little more stress going through puberty, and that can be one response there and a cause for that too. There's a lot of other causes there. They've ever had a car accident in their life, whiplash, stuff like that. The list goes on and on. It could be a huge list. It could be dietary related to chemical toxicity levels. The list is huge. And we do want to address those things too, but there's a lot of stuff you can do just to correct this. So if we see them doing this reverse breathing pattern, which is going to be probably about 80 to 90% of your clients, then what we want to do is we train them on this. Something else you can look at real quick as an assessment, flip over face down flat on the table.